When you live through a global health crisis, a pandemic, and you see people directly affected by a potentially deadly virus, you may begin to appreciate even more good health and good health care and better management of serious illnesses. Dr. Bethany Snider is Chief Medical Officer for Hosparus Health. And Dr. Snider, you have a new name for your palliative care programs. This is called Pallitus Health Partners. So we want to ask you this today. How do you explain palliative care? How is this different? How are these services different from hospice services?
So first, thank you so much for having me this morning. It's such a great question and something that people often struggle with. So palliative care is a type of care that's really patient-directed and focused on making the quality of life for patients with serious illness the best that it can be. The way that we reach that goal is by wrapping them and their family with an extra layer of support that's really focused on the stress and the burden of serious illness. So we walk along with those patients and families and their providers and really pay attention to symptoms such as pain or trouble breathing, anxiety, depression, and then the challenges at home and how can we help empower them to choose the care that makes their quality of life in those days the best that they can be. One thing I will highlight is this is different from hospice care, and so people that are eligible for palliative care would be on services for years with that advanced illness, and we walk with them through that time, and it doesn't limit any of the treatment that they can pursue for their illness. We just want to make sure that that treatment minimizes the impact on how they feel so that they can create more moments with their families.
Sure, so maybe not necessarily at end of life, right, which is typically what we think of when hospice steps in. And let's talk about those services specifically because you have several. You have a list of things as far as in-home visits, medication management, that 24/7 telephone access. Do you want to elaborate on some of those services that you offer through your palliative care program?
So we have a team of experts, which includes a palliative physician that's fellowship trained like myself, a nurse practitioner certified in palliative care, a social worker, and an RN. And all patients will be assigned that team, and they'll receive visits in their home, wherever they call home. That could be their residence, assisted living facilities, or long-term care facilities. And then we wrap them with 24/7 support, as you mentioned, where they can access their provider team after hours or on weekends with the goal of intervening sooner so that we can keep them out of the hospital and help them thrive in their home environment.
You also have a couple of disease-specific programs. So some people may be familiar with Heart Connection, where you're helping people that are battling cardiac disease. You also recently launched your lung care program. We do have a lot of people we know in Kentucky who battle these chronic lung diseases. So how can you help them manage their illness and their symptoms?
So what we saw is exactly what you just conveyed. We have so many people in our community struggling with heart failure and COPD as examples. And what their history often is that the disease changes and gets worse, they find themselves in the emergency room. So what we learned with heart failure first and then with lung patients is if we can do some special training and education, but then put medications in the home to intervene in those challenging times after hours on weekends, we can have success in keeping them out of the hospital. And we have so many stories of patients with heart failure or COPD that have been in and out of the hospital 6-7 times in a month. And once they get on our disease management programs, we can keep them at home and thriving for months and months and months. And so, our mission is just to help families create more moments. And that's what really led to these specialized programs where we saw a need in the community and we wanted to help fill that need.
And you said that need is certainly there, a 40% increase in the number of patients with chronic lung conditions who needed your supportive services in 2020.
Definitely.
All right, Dr. Snider, great talking with you. If somebody wants to learn more about Hosparus Health, your Pallitus Health Partners new program, your lung care program, how can they reach out and learn more?
So we try to make it as easy as possible. I will say anybody can refer themselves to our Pallitus program or our hospice services. All they have to do is give us a call. For palliative, it's 502-814-5408, or check us out on our website at www.pallitus.org, and you can put in a request and we'll reach out and do our best to get to you as quickly as we can.
All right. Thank you so much. Great talking with you today.
Thank you. Y'all have a blessed day.